Hello everyone, this is Dr. Amrita Gupta, Consultant Gynecologist and Infertility Specialist at Ishwarya Fertility Centre, Kolkata. Now, we often face various questions from patients like how long does IVF take? Is IVF suited for me? Is IVF painful? So let us address these questions today. To begin with, who are the patients where IVF can really benefit? Now, patients who have been trying naturally for a prolonged period of time but have failed to conceive. This could be due to various reasons, either due to the female partner or due to the male partner. In case of the female partner, it could be because of an ovulation or inability to produce eggs. In this situation, when various other treatments have failed to make the woman pregnant, she can opt for IVF. It could be other reasons such as advanced age, where the ability to produce eggs has come down, or where the tubes are damaged or blocked or have been ligated previously because of previous births. It could be because of male partner, where the defect lies in the semen test in the form of low sperm count or poor morphology, poor motility. So all these patients can definitely go in for an IVF. Now coming again to the next question. Is IVF painful? Well, now IVF is a well advanced technology, and with most of the injections being subcutaneous, that is, the injections have to be taken in the fat layer of the body, usually the abdomen, and the needles are very fine and thin, and so the procedure is almost painless. Now, how is the procedure carried out? To begin with, we do some tests and a scan on the lady. The test and the scan give us an idea about her ovaries, the capacity of the ovaries to generate eggs, her uterus, and the adnexa. Once we have found that everything is good for her, we can go in for her stimulation. At the same time, we also test the male partner with the semen analysis. So with this basic test done, we get an idea of what injections can be offered, what dose, and how long would injections be required. Once this is done, we start the stimulation process usually on the second or the third day of menses. These injections, as I said, are given in the subcutaneous layer and are so almost painless. These injections may be required for a period of 10 to 12 days regularly. During this time, the woman is scanned at regular intervals to see the growth of the follicles. Once we have achieved the desired number and size of the follicles, we take her up for ovum pickup. Now, this procedure is again done under anesthesia. So, this is a painless procedure. The woman will be completely unaware of the procedure. She would not feel the pain. Also, the anesthesia is light and so she can be discharged on the same day. So, you see that this process also does not hamper daily routine or her work routine. Once the eggs have been picked up on the same day, we again collect the semen from the husband, and the remaining procedure is done in the lab by expert and experienced embryologists, where by the process of ICSI, we inject the sperms directly into the egg and create embryos. These embryos are then allowed to grow in a culture media for 3 to 5 days. And then we again check their quality, and the good embryos are then frozen. After the freezing of the embryo, the second phase of preparation begins, that is preparing the uterus of the lady for the transfer or the embryo transfer. So again, we give some oral medications and we call the lady for scans where we check her endometrium or her uterine lining, and once a good lining has been achieved, we give some injections and take her for transfer. Once the transfer is done, most people have a question whether it requires a complete bed rest. It does not. Most researchers have suggested that a complete bed rest is not required. Light day-to-day activity and light work can be continued with IVF treatment. So again, this is a very normal treatment and it can be taken, does not require any drastic change in your lifestyle. So without any hesitation, apprehension or fear, please come forward for all your infertility issues, be it IVF or any other form of treatment. Thank you so much.